You know, in the high-stakes world of heart procedures, where literally a split second can change everything, there's this incredibly powerful drug designed to stop a dangerous chain reaction dead in its tracks. Today, we're diving deep into Abciximab.
So here's how we're going to break it down. We'll start with the problem, the clotting crisis inside our arteries. Then we'll zoom way in to see exactly how it happens. After that, we'll meet our hero, Abciximab, see how it's made, weigh its pretty serious risks, and finally, figure out where this amazing drug fits into medicine today.
Okay, so picture this. You're in a cardiac cath lab. A team is performing an angioplasty. They're using a tiny balloon to open up a blocked artery and get the blood flowing again. It's a life-saving procedure, for sure, but it also creates a brand new, immediate danger.
So what is that danger? Well, it's not just about the blockage they're trying to fix. The real, immediate threat is the body's own defense system kicking into overdrive and, well, making the problem even worse.
See, the very act of forcing an artery open actually injures its inner wall, and the body sees this injury as a wound that needs to be plugged, fast. So it sends in its first responders, these tiny things called platelets. Their job is to form a clot. But in this super delicate environment, that life-saving instinct can be absolutely catastrophic, re-blocking the very vessel that doctors just fought to open. All right, so let's go from that big picture problem of a blocked artery and zoom way, way down to the microscopic level. It really all comes down to these tiny little cell fragments, the platelets.
It all happens in 3 basic steps. First, the platelets get the signal. They rush to the scene of the injury and they activate. Second, once they're activated, these special little docking ports, they're called IIb IIIa receptors, pop up all over their surface. And then third, a protein called fibrinogen comes in and acts like a molecular rope, tying all those receptors together and locking the platelets into a solid clot.
And that brings us to the absolute key to this whole process, that IIb IIIa receptor. It's what we call the final common pathway. Think of it like the master switch for forming a clot. It doesn't matter what caused the alarm in the first place. If you want to form a stable clot, you have to flip this switch. And that is our target. So how do you stop it? Well, that's where Abciximab comes into the story. It's a drug designed with incredible precision to jump in at that one single critical step in the whole process. So how does it pull this off? Well, the best way to think about it is like this. If that IIb IIIa receptor is the docking port, Abciximab is basically a perfectly designed cap that just snaps right on top of it, physically blocking anything else from connecting. I mean, its mechanism is just so elegant and direct. It finds that receptor and latches on with an incredibly strong grip, essentially just shutting it down. And with all those receptors blocked, fibrinogen has nowhere to hook its ropes. The platelets just can't link up. The clot, it just can't form. Simple as that. Now, Abciximab isn't just some simple chemical they mixed up in a lab. Its design is actually a really sophisticated piece of bioengineering, and you can see that in its super long, complicated name.
Okay, that name is a mouthful, right? A chimeric monoclonal antibody Fab fragment. Let's just break that down really quick, because each part is kind of brilliant. Monoclonal antibody means it's incredibly specific. It only goes for one target. Chimeric means it's a hybrid, part mouse, part human, which is a clever trick to keep our immune system from attacking it. And Fab fragment means it's not the whole antibody, just the essential binding part, making it smaller so it can get where it needs to go more easily.
But here's the thing. When you have a drug this powerful, a drug that can literally turn off one of your body's most fundamental survival mechanisms, it doesn't come for free. Its greatest strength is, you guessed it, also its greatest weakness. The #1 risk, and this won't surprise you, is bleeding. If you stop clots from forming, you raise the risk of bleeding everywhere, from a small ooze to something truly life-threatening. It can also cause a sudden, sharp drop in the number of platelets, which is also really dangerous. And because it's technically part foreign protein, your body can build up an immune response to it, which means using it more than once can be risky.
So to manage all these risks, the dosing has to be incredibly precise. It starts with what's called a bolus, a single, fast push through an IV, to immediately shut down most of the receptors right before the procedure begins. Then, that's followed by a slow, 12-hour continuous drip to keep that protection going during the time when the risk of a new clot is the absolute highest.
So, with all that said, where does a drug like Abciximab fit in today? Well, its role has actually changed quite a bit since it first came on the scene.
If you put it side by side with other drugs in its class, Abciximab is the heavyweight. Its grip is so tight it's practically irreversible, and its effects can hang around for up to 48 hours. That's a huge contrast to other similar drugs, which are designed to be short-acting and easily reversible, giving doctors a different kind of control.
And because of that incredible power and those long-lasting effects, you don't really see it used routinely anymore. These days, we have newer, really good antiplatelet pills that are just easier and safer to manage for most standard procedures. So, Abciximab is no longer the go-to choice for every single patient.
Instead, it's found this new, vital role as a bailout therapy. It's the drug you save for the absolute toughest cases. We're talking about really complex procedures, where there's already a massive amount of clot, or when things suddenly start to go wrong on the table. It's the ultimate weapon you pull out when you need immediate, overwhelming, clot-stopping power, right now.
And that really gets to the heart of a challenge doctors face every single day. A drug like Abciximab is the perfect example of that constant risk versus reward calculation. It's an incredible tool, but it comes with significant dangers. And the real art of medicine isn't just knowing how a drug works, but knowing exactly when and for whom it's truly worth the risk.